Hello, PsycU community. Becky Wong here from the Osaka Field Medical Affairs team, and welcome to today's recording, the 12 Steps to Inclusivity in Mental Health Services, Part 1 of 4. Thank you for joining us. Today's recording is sponsored by Osaka Pharmaceutical Development and Commercialization INC and Lumbeck LLC. I am an employee of Osaka, and our speaker is a paid consultant for Osaka. Materials were developed in collaboration with our feature speaker, Dr. April Thames. At this moment, I would like to take a moment to introduce our feature speaker. Dr. April Thames is the Professor of Psychiatry, Chief Psychologist of the Adult Division in Psychiatry, and Associate Director of Medical Psychology Assessment Center at UCLA School of Medicine, and was the past Associate Professor of Clinical Neuropsychologist in the Departments of Psychology and Psychiatry at the University of Southern California. Dr. Thames have led several projects and was funded by organizations such as the National Institute of Health, Alzheimer's Association, and Robert Wood Johnson Foundation. Broadly, her work focuses on social determinants of cognitive health with a focus on how racial, ethnic, and social economic disparities impact cognitive and mental health outcomes. Welcome, Dr. Thames, to PsycU. And at this time, I would like to turn it over to you so that you can walk us through the first series.
Hello, PsycU community. I'm really happy to be here to discuss this important topic about diversity and inclusivity in the context of mental health care. And we'll be taking you through different steps. And the very first step comes with the provider and conducting an informed assessment. So we know that our own cultural identity and personal views around mental health can significantly impact patient care. So what I'd like to do is discuss some of the steps that us as providers can take to become more culturally inclusive, and also to think about what are our own personal biases and assumptions that we have, and how does that interact in the context of the patient-provider interaction. So the first step is the assessment of one's own self. So what does that actually mean? Well, before any patient encounter, and this really should actually happen early on in one's training, but unfortunately it doesn't. So sometimes, providers, even if they've been practicing for years, this is a really good exercise to take into consideration. It's important for the provider to conduct a self-assessment and to think about one's own cultural identity, values, assumptions, and biases. And there are some questions that can help guide the process. Now, I've had people say to me when I talk about self-assessments, I don't have a cultural identity, because they're assuming this has to do with race or ethnicity. But that is not true. We all have a cultural identity. We all have ways in which we grew up in communities that we identify with. And there's a lot of assumptions that are built around how we view others and how we actually view healthcare and what should happen in healthcare. So everybody has a cultural identity, so everyone can do this exercise. But the first question is to simply ask, what are aspects of your cultural identity? Thinking about gender, religious views, sexual orientation, race, ethnicity, nationality, where people grew up. Those are some elements of cultural identity to think about. And as professionals in the space of mental health care, that in and of itself is a cultural identity. So how does one's cultural identity shape views around mental health? That's something you have to ask yourself. How does my cultural identity shape how I perceive mental health? I may be completely comfortable talking about terms like depression and anxiety, but that may not be the same case for my patient. So that's an example of where I, as a professional, don't really stigmatize those terms, but our patients may stigmatize those terms. So thinking about what is the language that we're even using around mental health and the assumptions that come behind that. And also another question is, how does my cultural identity shape views about others? What do I expect from patients? Do I expect them to take a medication because it's recommended, or to do a particular psychotherapy because the doctor has recommended it? These are questions you need to ask yourself. And if the answer is yes, thinking about, well, why maybe some reasons that patients are not going to adhere to any sort of treatment recommendation. And when they don't, how do you view that? And so that's very important to ask yourself. And then to get a little bit more narrow is to think about, what are factors that make me least comfortable in working with patients from different backgrounds? Often it's the case that it's just not knowing, and a concern or a fear about doing something wrong or mishandling the situation. And that's okay to admit to oneself. Is thinking about the groups that we have the most difficulty interacting with, and really drilling down to think about why. So as we sort of walk through the assessment of self, there is an example and of how a provider can conduct one's own self-assessment. And based on the questions that I said in the previous slide, this is actually a response from an actual provider. And so I won't go through those questions because you all will have access to this deck. But if you just want an example of how this may look in real life, this is a good example of that. So as we go through the assessment of self, it's an exercise to really help the provider to think through aspects of his or her cultural identity that influence interactions with patients. We start with a really broad question. What is my cultural identity? And then we narrow it down to specific questions to uncover some personal biases. Now, this is not an exercise that you want to probably do with other people, because why? We all have a tendency to want to be socially desirable. We don't want to say something that might make us seem as we are being discriminatory in any way or stereotyping in any way. But we all have to face the reality that we all have biases and assumptions about certain cultural groups. Nobody is colorblind. And so anyone who says that, I would highly recommend that you think through this a little bit more, because I think if we were all to drill down and think about which groups we feel comfortable with, which groups we feel uncomfortable with, and the reasons why, we start to discover perhaps a lot of it has to do with familiarity. We tend, and the research shows this, we tend to like people who are familiar to us and people who are like us. That's a natural human tendency to have an affinity to somebody who is more like us. And for people who are different, there's a natural tendency to be concerned about interacting and to not know how to interact. So this is a natural human bias that we all have. And I think the more that we can be introspective and be aware of it, we can provide better patient care. So as we walk through assessment, we talked about self-assessment already, but now we need to think about, what are some of the structural barriers to mental health care? And we need to think about this because as providers, there are several factors that may prevent patients from being able to access treatment and to follow through. And the follow through is often the most difficult that I see. So some of the structural factors, and this is not exhaustive list, but these are the main factors that tend to come up. A structural barrier often has to deal with insurance. Some insurances often deny mental health care services, or they limit the amount of mental health treatment that one can receive. And so it's important as a provider to recognize that and to think about within these limitations of the patient's insurance, how am I going to provide them with the best type of care? Transportation is another issue. Often the more regarded mental health care treatment facilities or centers tend to be in more affluent communities. And so that can be a huge barrier for people being able to get in to see the best doctors that are in mental health care. So transportation is an issue to think about. That could be a structural barrier. And also encounters with racism and discrimination that occurs in the healthcare setting. We know through several studies that there are instances of discrimination that occur, particularly among individuals of color, individuals where English is not their primary language. And we have to be aware of this, be aware of people's experiences with the doctor. And if that experience has not been good or positive, it's really hard to get people to accept treatment, to actually go and follow through. Okay, so thinking about the structural barriers, you can actually ask questions to your client to get a sense what may be some potential barriers to them receiving appropriate mental health care. You can ask how far they live from the facility. Ask them about how they transport themselves around. Are they driving independently? Do they have to rely on a family member? Are they taking the bus? These are things that as providers we need to know, because if someone doesn't show up for an appointment, rather than just dismissing that patient, maybe thinking about, well, this person has to commute by bus 2 hours to get to the appointment. So if they miss an appointment, that's not particularly shocking. Also, we can ask about insurance. Now, this is often more difficult for patients to know. They know what insurance plan they have, but they often don't know what's covered. So this is where interacting, and we'll talk about this later, but with administrative staff can be helpful. I think we have to take more of the onus of learning about different insurance plans and what they cover and what they do not cover. And it's also helpful to ask patients, would you prefer if we meet by video conference instead of by person? Because maybe for the person who has difficulty getting to the facility, Zoom or GoToMeeting, whatever video conference format that you use, this might be a really good way of providing care. And I think since the pandemic, people have seen how beneficial using video conferencing for mental health services can be in actually reaching people we would not normally reach. And you can also ask about their experiences with doctors and other healthcare professionals. And you can say, tell me about your experience with previous psychiatrists, psychologists, mental health workers, anybody within the domain. You want to get a sense. And I recently had a patient where I really thought I was doing an assessment and I thought psychotherapy would be great for this person, because as I was doing my assessment, I really could pick up that the patient wanted to talk and sort of emote about some previous trauma that they had experienced. But I was functioning in the role as doing an assessment to sort of answer a referral question. I was not in the role of providing therapy. And so I recommended psychotherapy, but before I did, I said, what's been your previous experience with therapy? And the patient said, it was awful. The doctor didn't look at me. He started talking about what he was going to do over the weekend, and it was all about the provider. The provider did not ask the patient anything about themselves. And that's a really bad experience. And that unfortunately happens more often than not and really colors people's perceptions of mental health care. So it's important to get that information and to also educate that not all the experiences have to be like that. And to educate patients about the way it should be. And I find myself doing that all the time. I'll say, in therapy, because as a psychologist, that's my domain of where I understand the most. And I'll say, they're not supposed to tell you what to do. That's not therapy. A psychologist is not like your friend that you're just talking to. This is a space where together you work collaboratively. And these are things that I often find myself having to educate my client. Okay. And so as we assess the mental health setting, this is a lot different than structural barriers. So now we're moving into more specifics about where we actually work. And so thinking about insurance plans, we know that this is a socioeconomic status issue. It's important for us to learn, and I've already said this, about what plans cover and what they do not cover. And we know that navigating insurance plans can be extremely complex. So it is really up to us to consult with the people in our office who have the day-to-day interactions with insurance. And it's important to relay that information, if we can, to the patient so that they know it's not that you don't want to provide them with more therapy. It's unfortunately, this is what their plan covers, and to try to help them think about, well, what are some alternatives to that? And in addition to thinking about insurance, we need to think about within the setting that we work in, are the administrative leads committed to cultural competency and diversity and inclusivity training? And so this is really easy to find out whether there's training or not. And if there's not, I think it's important to ask why. We also should think about the setting, whether or not there's availability of mental health translators. We do not want the patient's family to serve as the translator. This is not the way that we should be providing services. Every setting should provide some type of access to an independent translator, and most optimally one that has been trained in mental health, because there are a lot of terms that we tend to use that we want that translator to be aware of. And we know that if we don't have the interpreters, we will be missing out on a huge segment of the population who might find it impossible to seek help in the first place. And so as we think about the mental health setting, there are ways to develop strategic planning and quality indicators to think about basically a program evaluation of one's own setting. And there are some ways to do this. One is by creating benchmarks of success. We can think about how well are we reaching target goals. And there are several examples of indicators that are on the slide, but I'll just name a few that I think are important. But thinking about, the number of cases that could avoid admission to the hospital with appropriate external intervention. I think we need to move in the space of prevention. When we think about health equity, both with primary prevention, secondary, and tertiary care, we know that there are inequities across all those spaces. We don't want people to go into the hospital if they don't need to. So we need to really, from the front, we need to think about what are some benchmarks of prevention that our setting can provide to keep people out of the hospital. And that's one way to try to develop a strategic planning and quality indicator plan. So I hope that this series has been helpful thinking about how the provider can play an active role. One, thinking about themselves. Second, thinking about some of the structural barriers that our patients from various diverse groups are likely to experience, and to think about our own setting and what can we do to be an advocate if those benchmarks are not already in place.
Thank you so much, Dr. Times. And actually, you just reminded me, and I want to remind the audience that you brought up insurance quite like throughout today's presentation. And I think insurance and the provider having education around the different type of insurance coverage is critical when we're delivering care. So I do encourage the PsycU community. We do have a mental health system guidebook for the whole US that you can easily download that provides tons of resource and information in regards to insurance and the mental health care setting in general for your particular state. So I encourage everyone, if you are not familiar with the mental health guidebook, please go on PsycU and download that resource. And thank you again so much for your thorough review. It was wonderful. I learned so much. And I hope everyone enjoyed the session as well. And this concludes part 1 of this series. And we would like to invite everyone to please join us for part 2 of the 12 steps to inclusivity in mental health care setting. Thank you.